Addiction is the largest public health crisis of our time. 23 million people are seeking treatment every year, and only 3.1 million people are getting the inpatient treatment that they're seeking. I'm actually in long-term recovery. Once I hit my bottom, I went into treatment, and it was there that I learned that the relapse rate is alarmingly high, that 85% of people relapse within the first year of recovery. At the end of the 28-day treatment period, you're left with a piece of paper and pretty much told, good luck, find your way through recovery. And I thought, no wonder the relapse rate is so high.
It's personal for me in that I'm in long-term recovery. The first year in recovery is the most important year. WEconnect Health is going to change the world of recovery.
WEconnect is a mobile app that helps the individual that's in recovery from drug and alcohol addiction to be able to stay accountable to their treatment plan and connected to their community in real time, so that they can continue on their recovery journey. Patients
can download the app and tailor-make a recovery aftercare plan just for them. And they do that with the help with therapists, clinicians, counselors, because at the treatment center, there's a data dashboard that's going to know who's at risk of relapse and for what reasons.
We have the perfect combination between scientists, technologists, marketing, sales, and then folks in long-term recovery or those affected by addiction, so that we can actually build a product not just for the individual in recovery, but to heal and help the entire family system thrive in recovery. We utilize 3 evidence-based practices. The first one is community approach. A lot of people stay in recovery a lot longer if they have the community support from peers that are also in recovery. Second are different flavors of cognitive behavioral therapy that keep people engaged in order to stay in active recovery. The third is the use of contingency management, where you get vouchers and rewards for continuing a certain behavior change. So it's using positive reinforcement to keep someone motivated, which has proven to be 50% more effective than other methodologies in terms of reducing relapse risk.
If we're addressing the 3 factors which lead to relapse, which is lack of accountability, lack of connection, and lack of support, we're halfway home to getting through today.
When I got into recovery, I felt actual peace and joy for the first time in my life. And so when I think about building WEconnect, I want to extend those moments of joy for other people. And I really believe that the app can do that.
It's about keeping recovery front of mind. If I'm opening up my WEconnect app, checking off the boxes of the things that have been prescribed to me as relapse prevention, I have a really good chance of staying clean and sober today.